Hello, aspiring medical professionals. Have you ever wondered what lies at the core of understanding diseases? It's pathology, the scientific study of the nature, causes, and effects of diseases. Pathology is the bridge between clinical medicine and the laboratory, providing crucial insights into the mechanisms underlying various health conditions. At the heart of pathology lies the study of cells. Every disease, regardless of its complexity, originates from cellular abnormalities. Pathologists meticulously examine these cells, looking for any deviations from the norm. By understanding these cellular changes, they can not only diagnose diseases but also predict their progression and devise appropriate treatment strategies. Now we will look into our first topic, growth adaptations. Let's dive into basic principles. In pathology, growth adaptations refer to the cellular and tissue changes that occur in response to various stimuli or stresses. Here are some of the basic principles of growth adaptations in pathology. Reversible nature. Most growth adaptations are reversible if the underlying stimulus is removed. For example, if a muscle undergoes hypertrophy due to increased workload, exercise, it can return to its original size if the exercise regimen is discontinued. Cellular response to stress. Cells respond to stressors by adjusting their size, number, or function to maintain homeostasis and ensure survival. This can manifest as hypertrophy, increased cell size, hyperplasia, increased cell number, atrophy, decreased cell size, or metaplasia, conversion to a different cell type. Adaptive versus maladaptive. Growth adaptations can be either adaptive, beneficial, or maladaptive, detrimental, depending on the context. For instance, hypertrophy of the heart muscle in response to increased workload, for example exercise, is adaptive, but in the case of chronic hypertension, it can become maladaptive and lead to heart failure. Mechanisms of growth adaptation. Various signaling pathways and molecular mechanisms govern growth adaptations. These include activation of growth factors, modulation of gene expression, and alterations in cell signaling pathways to promote cell survival or proliferation. Pathological implications. Disruption in the balance of growth adaptations can lead to pathological conditions. For example, uncontrolled cell proliferation can result in tumor formation, while persistent cell damage can lead to irreversible tissue injury. Diagnostic significance. Understanding growth adaptations is essential for pathologists to interpret tissue changes in disease states accurately. Recognizing the patterns of growth adaptations can aid in diagnosing specific conditions and guiding treatment strategies. By comprehending the basic principles of growth adaptations in pathology, healthcare professionals can gain insights into cellular responses to stressors and the development of various diseases. This understanding forms the foundation for effective diagnosis, treatment, and management of pathological conditions. Hypertrophy. Hypertrophy refers to an increase in the size of individual cells, leading to the enlargement of the affected tissue or organ. Mechanism. During hypertrophy, cells accumulate more structural components, such as proteins and organelles, causing them to grow larger without an increase in cell number. Causes. Hypertrophy often occurs in response to increased functional demand or stimuli, such as exercise-induced muscle hypertrophy, or the thickening of the heart muscle, left ventricular hypertrophy, in response to chronic hypertension. Adaptive or pathological. Hypertrophy can be either adaptive, such as in the case of muscle growth in response to exercise, or pathological, like the hypertrophy of cardiac muscle seen in heart disease. Reversibility. Hypertrophy can be reversible if the initial stimulus is removed, but in some cases it may progress to irreversible damage if left untreated. Hyperplasia. Hyperplasia is an increase in the number of cells in a tissue or organ, leading to its enlargement. Mechanism. Hyperplasia results from cell proliferation, usually in response to specific stimuli or growth factors, causing an increase in the total cell count. Types. Hyperplasia can be physiological, such as the proliferation of breast tissue during pregnancy, or pathological, like benign prostatic hyperplasia in older males. Regulation. Hyperplasia is tightly regulated by various signaling pathways and growth factors to ensure controlled cell division and tissue growth. Clinical significance. Hyperplasia can serve as a precursor to certain conditions, including the development of tumors or neoplasms if unregulated cell growth continues. While hypertrophy involves an increase in cell size, Hyperplasia involves an increase in cell number. Understanding the distinction between these growth adaptations is crucial in both physiological and pathological contexts, as they play significant roles in tissue responses to various stimuli and in the development of diseases. Atrophy. Atrophy is another important type of growth adaptation in pathology, and it refers to the decrease in the size and function of cells, tissues, or organs. Here are some key points about atrophy. Definition. Atrophy is characterized by a reduction in cell size, leading to a decrease in the overall size of the affected tissue or organ. This reduction results from decreased protein synthesis and increased protein degradation within the cells. Causes. Atrophy can occur due to various factors, including disuse, lack of physical activity, denervation, loss of nerve stimulation, ischemia, reduced blood supply, malnutrition, aging, or hormonal changes. Physiological examples of atrophy include the involution of the thymus gland with age or the shrinkage of the uterus after childbirth. Types. There are two main types of atrophy, physiological and pathological. Physiological atrophy is a normal process that occurs during development or as part of the body's adaptive responses. For example, the shrinkage of the thymus gland after puberty is a form of physiological atrophy. Pathological atrophy is a response to disease, injury, or other abnormal conditions. For instance, muscle atrophy often occurs in conditions of prolonged immobility or during malnutrition. Consequences. Atrophy can lead to a decrease in tissue function and structural integrity. In skeletal muscle, for example, atrophy results in reduced strength and functionality. If atrophy persists, it can have detrimental effects on overall health and may contribute to the progression of certain diseases. Reversibility. In some cases, atrophy can be reversible if the underlying cause is addressed. For instance, muscle atrophy due to disuse can often be reversed through physical rehabilitation and exercise. Understanding atrophy is crucial in diagnosing and managing various conditions as it reflects the body's response to stress, disuse, or disease. By recognizing the signs of atrophy and addressing the underlying causes, healthcare professionals can help prevent further tissue damage and restore function to affected areas. Metaplasia is a type of growth adaptation in which one differentiated cell type is replaced by another differentiated cell type in response to chronic irritation, inflammation, or other stimuli. Here are some key points about metaplasia. Metaplasia is a process in which one mature cell type is replaced by another mature cell type, which is better suited to withstand the changes in the cellular environment. Causes. Metaplasia usually occurs in response to chronic irritation, inflammation, or other stresses that prompt the replacement of one cell type with another that can better tolerate the altered environment. Examples. One common example of metaplasia is the transformation of the normal, pseudo-stratified columnar epithelium in the respiratory tract to stratified squamous epithelium in response to chronic cigarette smoke exposure, respiratory epithelial metaplasia. Barrett's esophagus is another example in which the normal stratified squamous epithelium of the esophagus is replaced by columnar epithelium due to chronic acid reflux. Implications. While metaplasia may help protect tissues from damage in the short term, the replacement of one cell type with another can have implications for tissue structure and function. Metaplastic changes may increase the risk of developing further complications or diseases, such as an increased risk of cancer in tissues that have undergone metaplasia. Reversible versus irreversible. Metaplasia can be reversible if the underlying stimuli are removed. For example, if the chronic irritation or inflammation ceases, the metaplastic changes may regress. However, if the stimulus persists, metaplastic changes may become more entrenched and potentially progress to dysplasia or neoplasia, further complicating the tissue's state. Understanding metaplasia is important in the field of pathology, as it provides insights into how cells and tissues adapt to chronic stressors or irritants. Monitoring and addressing metaplastic changes are crucial in assessing disease progression and developing appropriate management strategies to prevent further complications. Aplasia and hypoplasia are conditions related to development where cells, tissues, or organs fail to properly form or grow. Here are the key differences between aplasia and hypoplasia. Aplasia. Aplasia refers to the complete absence or failure of development of a particular tissue, organ, or cell type. Characteristics. Aplasia results in a complete lack of formation, leading to a missing structure that should have normally developed. Causes. Aplasia can be congenital, present at birth, due to genetic abnormalities, environmental factors, or disruptions during fetal development. Clinical relevance. Aplasia typically results in severe functional deficits or organ failure, depending on the affected structure. Examples include aplastic anemia, where the bone marrow fails to produce blood cells, or congenital aplasia of the optic nerve, leading to visual impairment. Hypoplasia. Hypoplasia is characterized by underdevelopment or incomplete growth of a tissue, organ, or cell, resulting in a smaller size or reduced cell number. Characteristics. In hypoplasia, the affected structure is present, but is smaller in size or has fewer cells than normal. Causes. Hypoplasia can also be congenital and may be caused by genetic factors, nutritional deficiencies, hormonal imbalances, or environmental exposures. Clinical relevance. Depending on the extent of hypoplasia and the affected organ, individuals may experience functional impairments or complications. Examples include renal hypoplasia, where the kidneys are underdeveloped, leading to renal insufficiency, or hypoplastic left heart syndrome, a congenital heart defect involving incomplete development of the left side of the heart. Understanding the distinctions between aplasia and hypoplasia is crucial in diagnosing developmental abnormalities and guiding appropriate management strategies. These conditions reflect variations in normal tissue development and can have significant implications for overall health and well-being. Cellular injury. Cellular injury refers to the damage or harmful changes that occur within cells as a result of various insults or stressors. Here are some key points about cellular injury. Causes. Cellular injury can be caused by a wide range of factors, including physical agents such as trauma or heat, chemical agents, toxins or drugs, biological agents, pathogens or parasites, nutritional deficiencies, genetic abnormalities, immune reactions, and ischemia, lack of oxygen supply. Types. There are different types of cellular injury, including reversible injury, where cellular functions can be restored if the damaging stimulus is removed, and irreversible injury leading to cell death. Cellular injury can manifest as structural changes, for example, swelling, vacuolization, functional alterations, for example, impaired protein synthesis, decreased energy production, or biochemical changes, for example, enzyme leakage, oxidative stress. Consequences. If cellular injury is mild or short-lived, cells may recover and return to normal function. However, severe or prolonged injury can lead to cell death, inflammation, tissue damage, and organ dysfunction. Repeated or chronic cellular injury can contribute to the development of various diseases, including neurodegenerative disorders, cardiovascular diseases, and cancer. Response to injury. Cells respond to injury through various adaptive mechanisms, such as activating repair processes, upregulating protective genes, initiating apoptosis, programmed cell death, or triggering inflammatory responses. The response to cellular injury aims to either restore cellular homeostasis or eliminate damaged cells to prevent further harm to the organism. Diagnosis and treatment. Understanding the mechanisms of cellular injury is crucial for diagnosing and treating various diseases. Diagnostic tests, including imaging studies and laboratory investigations, can help identify cellular damage. Treatment strategies for cellular injury may include removing the injurious agent, providing supportive care, enhancing cellular repair mechanisms, and addressing underlying conditions contributing to the injury. Cellular injury is a fundamental concept in pathology and is integral to understanding the pathogenesis of various diseases. By elucidating the mechanisms and consequences of cellular injury, healthcare professionals can develop targeted interventions to mitigate damage, promote healing, and restore cellular function. Hypoxia. Hypoxia is a condition characterized by a reduced level of oxygen in tissues or organs, which can lead to cellular injury and impaired function. Here are some key points about hypoxia. Causes. Hypoxia can result from various factors, including decreased oxygen content in the air, for example, at high altitudes, inadequate oxygen delivery to tissues, for example, due to cardiovascular or respiratory disorders, impaired oxygen utilization at the cellular level, or reduced blood flow ischemia to a particular area. Types. There are different types of hypoxia, including hypoxic hypoxia, low arterial oxygen tension, anemic hypoxia, reduced oxygen carrying capacity of blood, stagnant hypoxia, reduced blood flow, and histotoxic hypoxia, inability of tissues to utilize oxygen. Effects. Oxygen is essential for cellular respiration and energy production. In the absence of adequate oxygen, cells switch to anaerobic metabolism, leading to the production of lactic acid and a decrease in ATP, adenosine triphosphate production. Prolonged or severe hypoxia can result in cellular dysfunction, oxidative stress, inflammation, and ultimately cell death. Consequences. Hypoxia can have detrimental effects on various organ systems, including the brain, heart, lungs, and kidneys. It can lead to tissue damage, organ failure, and if left untreated, irreparable harm. Chronic hypoxia is associated with conditions such as chronic obstructive pulmonary disease, COPD, heart failure, sleep apnea, and certain types of cancer. Treatment of hypoxia focuses on restoring adequate oxygen supply to tissues. This may involve providing supplemental oxygen, improving blood flow through interventions like reperfusion therapy, treating underlying conditions contributing to hypoxia, or enhancing the body's ability to utilize oxygen efficiently. Clinical manifestations. Symptoms of hypoxia can vary depending on the severity and duration of oxygen deprivation, but often include shortness of breath, cyanosis, bluish discoloration of the skin, confusion, rapid heart rate, and loss of consciousness. Understanding the causes, effects, and consequences of hypoxia is crucial in diagnosing and managing conditions associated with oxygen deficiency. Timely intervention to address hypoxia can help prevent irreversible tissue damage and improve patient outcomes. Reversible and irreversible cellular injury. Cellular injury can manifest in different forms, ranging from reversible to irreversible damage, depending on the severity and duration of the injurious stimulus. Here are some key differences between reversible and irreversible cellular injury. Reversible cellular injury. Definition. Reversible cellular injury refers to cellular changes that can be undone if the damaging stimulus is removed and cellular homeostasis is restored. Characteristics. In reversible injury, cellular functions may be impaired, but the structural integrity of the cell is maintained, and the cell has the potential to recover and return to normal function. Examples: swelling of organelles, cytoplasmic vacuolization, and changes in metabolic activity are reversible cellular changes that can occur in response to mild or transient stress. Irreversible cellular injury. Definition. Irreversible cellular injury refers to severe damage that leads to permanent alterations in cellular structure and function, culminating in cell death. Characteristics. Irreversible injury results in extensive cellular damage, disruption of cell membranes, and loss of cellular integrity, making it impossible for the cell to recover or survive. Examples: severe oxidative stress, overwhelming calcium influx, and prolonged oxygen deprivation can trigger irreversible cellular injury and cell death in the form of necrosis or apoptosis. Consequences. Reversible cellular injury may lead to cellular dysfunction, but if the stressor is eliminated or if repair mechanisms are activated promptly, cells can regain normal function. Irreversible cellular injury, on the other hand, results in the disruption of cellular processes, loss of structural integrity, and ultimately cell death, contributing to tissue damage and organ dysfunction. Clinical relevance. Identifying whether cellular injury is reversible or irreversible is crucial in determining treatment strategies and predicting patient outcomes. Effective interventions for reversible cellular injury focus on removing the injurious agent, promoting cellular repair, and preventing progression to irreversible damage. Understanding the distinctions between reversible and irreversible cellular injury is essential in assessing the extent of cellular damage, determining appropriate treatment approaches, and mitigating the impact on overall tissue and organ function.